Welcome back. In this video, we'll talk about the different types of Down syndrome and how common the condition is. Approximately 1 in every 700 newborns will have Down syndrome, making it the most common chromosomal abnormality. We divide Down syndrome depending on the cause. The first cause is the Nondisjunction, which is the most common type. Normally, all of our cells have a pair of every chromosome. However, during pregnancy, we want to merge the chromosomes of the father, which come from the sperm, with the chromosomes of the mother, which comes in an egg. But before this merging process occurs, both the sperm and the egg has to lose one pair of every chromosome. In non-disjunction Down syndrome type, sometimes either the sperm or the egg fail to lose one pair of the chromosome number 21. And so when they merge, they will end up with 3 copies of chromosome number 21. And because this new fertilized egg has 3 copies of chromosome 21, every single cell in the newborn will also have 3 copies of chromosome 21. This kind of defect or error accounts for about 95% of cases of Down syndrome. The other type is translocation. In this type, we have a perfect number of pairs of every chromosome, but the problem is some cells have a pair of chromosome 21 attached to another chromosome. So the karyotype will show a pair of 46 chromosomes without an additional chromosome 21, but there will be some fragments of chromosome 21 either attached to another chromosome or sometimes a full copy of chromosome 21 attached to another chromosome. This extra part of chromosome 21 mostly attaches to chromosome number 14, and this accounts for about 4% of cases. Unacademy is the largest Indian teaching platform. They have a variety of interesting topics and courses, and recently they have extended their courses to include topics for the USMLE and the Step 1 exam. The USMLE course checks all the important marks, including recognized names like Dr. Najib and Dr. Raj, and of course many other skilled teachers. It has more than 800 recorded lectures and comprehensive videos. Unlike all good courses, they also have their own Q bank with more than 3,000 questions and 300 review videos. For a limited time only, the course will have 75% discount with an additional 10% discount if you use my coupon AMAD10. Once you purchase the course once, you will have free access for a full year. The third and final type is known as Mosaicism, and this occurs in about 1% of cases, making it the least common cause of Down syndrome. In this type, some cells will have perfectly normal chromosomes and karyotype with no additional copies whatsoever, while other cells will have an additional copy of chromosome 21. So the patient have mixture of both types of cells. These patients understandably have less symptoms of Down syndrome.